So Noah and I will be presenting on toxic B12 deficiency. It is a demyelination disorder. So first and foremost, in the introduction, Noah, next slide, please.
Can you not do
No,
it? Okay.
I can't switch.
Okay, sorry.
Vitamin B12 is also otherwise known as cobalamin. It's a water-soluble vitamin. You get it from animal products, but it is actually produced by bacteria in those. That's just how we ingest them. There's a graph at the bottom describing the foods that are high in vitamin B12, like fish and eggs, dairy, red meat, and oysters. So what the cobalamin does is it's a cofactor for enzymes involved in synthesis for DNA and fatty acids and myelin, which is why a deficiency in this is a demyelination disorder. Deficiency leads to hematologic, and neurologic symptoms. And that's also the structure of B12. Next, depending on the etiology, determines kind of the demographics of this disease. So it's the most common in elderly adults and patients with anemia, specifically pernicious anemia. And among those, 1 to 2% of those anemias are due to B12 deficiency. Patients with macrocytosis, around 18 to 20% of those are due to B12 deficiency. And it is more common in people of Northern Europeans with the pernicious anemia, because that's where that anemia is found. And of those with neurological symptoms, up to 40% of those are due to B12 deficiencies. So the etiology, there are 3 primary etiologies. There's autoimmune, and that's when the antibodies are attacking the intrinsic factor that produces the myelin. The inability of B12 is of B12 to absorb in the terminal ileum. Then there's malabsorption syndrome. Intrinsic factors are produced in the parietal cells. So if there is damage to the terminal or intestines, then it impairs the B12 absorption. And also damage to the small intestine. And this can be caused by Crohn's disease, celiac, tapeworm, or gastric bypass. Then there's just dietary insufficiency. So vitamin B12 is stored in the liver, and you can damage that source of liver if you are following a strict vegan diet for long periods of times and not supplementing the B12 otherwise. So next we have the normal versus abnormal neuroanatomy in the brain and spinal cord. This disease does affect both the CNS and the PNS, but this is a case study. The pictures are from a case study of a child who was diagnosed with B12 deficiency. And on the left, the small picture is a normal scan of the brain. But as you can see at the time of diagnosis, there are white matter lesions in both hemispheres of the brain. And in the spinal cord, it shows degradation. And after 42 months of treatments, there was a regression of the lesions in the brain. So it begins to look more like the normal. So now I'm going to pass it on to Noah to describe the manifestations.
So for the manifestations, the most common signs of vitamin B12 deficiency is fatigue. It is caused by a lack of red blood cells to carry oxygen to the body tissue. So then a lack of red blood cells may also cause weakness, shortness of breath, dizziness, headache, pale or yellow skin, chest pain, sensory and motor impairment, poor memory. So these are just a few, but the most common symptoms for mild are fatigue, headache, and weight loss. And then for severe, 12 would be impaired balance, muscle weakness, and mood changes, especially depression. So then we go on to diagnosis and diagnostic testing. So it can be difficult to diagnose B2 deficiency because symptoms are not always present, or symptoms can mimic other nutritional deficiencies. So the test used to diagnose vitamin B12 deficiency is a complete blood count and vitamin B12 blood test levels. So a person diagnosed with vitamin B12 deficiency, if the amount of vitamin B12 in their blood is less than 150 per milliliters. We move on to the treatments. So it's often treated with cyanoblamina. So this is a man-made form of vitamin B12. So depending on how severe the person may have to be treated, depending on how severe the vitamin B12 levels are, they may have to be treated for their whole life or just until their numbers rise back up. So this can be done with vitamin B12 oral medication, injection, nasal gels, nasal spray, and then you can also incorporate red meat, fish, poultry, egg, milk, and other dairy products that contain vitamin B12. But if any nerve damage that happened when you were in a deficiency, it could be permanent. So then for recent findings, I found that in a study, vitamin B12 acts as a coenzyme that facilitates myelin synthesis. So a defect in myelin synthesis can lead to both central and peripheral nerve function abnormalities. So some conditions that we're seeing include neuropathy, and optic nerve atrophy. So then here is an image depicting the spinal cord of the recent study. It can become involved in several syndromes often seen with this is subacute combined degeneration, so SCD for short. So in this MRI, it revealed an inflammation of the spinal cord, mostly in the T2 levels. So clinically, presentations of SCD include bilateral sensory deficiency, most common affecting bilateral lower extremities. So they're going to have trouble moving, so extreme weakness, and then also positive Romberg sign and abnormal reflexes. So then that is our presentation, and then here are our sources.